Thank you for the lovely introduction. So today I am going to be speaking to you about simulation in midwifery education, a bit about simulation itself, and then I'll go on to talk about what we've been doing as a midwifery team at the University of Bradford. So the aims of this evening are to explore simulation as a pedagogical approach in midwifery education, to discuss the new midwifery space that we have at Bradford, and I'll be looking at it from the design, development, what our vision was, and how that vision is coming to fruition now that we're able to utilise it. To share some initial feedback and experiences that we've had since the space opened at the beginning of September this year, and to discuss the potential research opportunities that the new space will facilitate. So first, I thought, as with anything, a definition would be useful. So I have looked at 3 definitions of what simulation is, and I don't think anyone completely captures it, but I think actually considering them all is important for educators, because I think defining what we are going to be doing as far as simulation goes is important. So the first one is from the dictionary. So simulation is a situation or event that seems real but is not real, used especially to help people deal with such situations or events. That's in a broader context, not specific to healthcare. And then slightly more focused, simulation-based education is the pedagogical approach of providing students with the opportunity to practice, learn skills in real-life situations. And the third one there is from the NMC, so an educational method which uses a variety of modalities to support students in developing their knowledge, behaviours and skills, with the opportunity for repetition, feedback, evaluation and reflection to achieve their programme outcomes and be confirmed as capable of safe and effective practice. Now, I've chosen the bottom 2 particularly, as one defines simulation as a pedagogical approach and the other one defines it as an educational method. And I'll talk about that on the slide after this one. So when we're thinking about why simulation in healthcare, so it helps students and practitioners in healthcare to gain skills, knowledge and apply behaviours that they may need in practice. It develops integrated learning, critical thinking and decision making. And the big thing with simulation is it provides a safe space for healthcare students, healthcare practitioners to learn a skill in real time, and have that safe space to make mistakes, to learn from them, but to also immerse themselves in that real time scenario, which can be really valuable. So traditionally, simulation is an education technique for skill acquisition, but now being used more broadly to improve care and outcomes in healthcare. The body of research on simulation is only continuing to grow, and as our scope with simulation, or our scope to facilitate simulation, expands with evolving digital technologies, that is only going to continue and to expand. And then simulation-based education is a valuable tool for transitioning in practice from student to midwife. And the evidence base shows that this is the same for any healthcare profession, that simulation-based education, giving students those opportunities that other pedagogies may not facilitate in the same way. So as I spoke about a couple of slides ago, so thinking about simulation as a pedagogy versus a teaching method. So this continues to be a debate. So a pedagogy would be an approach to teaching, the underpinning philosophy of teaching, of how we approach it. So much more deeper theory, whereas a teaching method would be a method to facilitate teaching. And so a lot of the research that we have at the moment focuses on simulation in midwifery education used as a teaching tool within other pedagogical approaches, as opposed to its own standalone pedagogy. And what I'm extremely interested in is looking at simulation as an all-encompassing pedagogical approach to education, because actually I think that when we think about how we look to teach, we need to think about it from a very holistic approach, how we facilitate teaching, but also how we experience teaching and experience simulation on those deeper levels, and then how that impacts our learning, our practice, and then ultimately the experience that we give to patients as practitioners, as student midwives. And so it continues to be a debate, but I hope that with evolving research and evolving implementation of simulation as a pedagogy, we'll have some more evidence to underpin it, to underpin the philosophy ourselves. So the bottom two kind of arguments there. So Earl and Mattel argued that simulation is not a pedagogy but a teaching tool, and that it lacks the philosophical underpinning. The lack of philosophical underpinning justifies this definition, which, as I said, I'm hoping that particularly with evolving research, hopefully with my own research, that will add to that justification. And then Cook et al. Say it is a pedagogy, and it improves learners' skills and behaviours and can improve patient outcomes. But the debate is still there, and as it said at the beginning, anything is subject to healthy debate. So it's hopefully something that will continue to evolve. So different types of simulations. So we've got unfolding case studies, high fidelity mannequins, low fidelity task trainers. We've got things like remote simulation, which we can facilitate from online from different locations, role playing and use of actors, the use of VR and AR. Things like tabletop simulations, where we're looking at, for example, looking at award, patient allocation, anything there. We've got e-learning. And one thing that I've missed out on there, which is only going to continue to evolve, is the use of AI in simulation, which I think, again, over the next few years is going to become more and more prevalent, probably interwoven with a lot of the ones that are listed here. But I think, again, that will be very transformative in how we deliver any education, but also particularly simulation. So advantage and disadvantages of simulation. Oh, I apologise. So the advantages: it offers a diverse approach to learning. It enables diverse and flexible learning for students. It helps to bridge the theory and practice gap. So because simulation is facilitated in what it can be a very immersive environment, a real-time environment, particularly, and there's a lot of research, if it's an interprofessional environment that simulates practice, it can really help to bridge that theory-practice gap. And then in the debriefing aspect of simulation, a lot of the deeper theoretical learning can come into that. The evidence base shows that it improves student knowledge compared to traditional learning methods, and it can improve student confidence. So we are giving learners the opportunity to potentially access situations that they may not be able to access in practice if they're uncommon, or giving them the opportunity to access them before they then have to manage them. And the evidence base is really good for supporting that development in student confidence. The disadvantages of simulation, as with anything, there's always disadvantages. It is very staff and resource heavy, so it takes a lot of planning, a lot of logistical input, and it needs a lot of staffing to run effectively. Because if we want to make it authentic, real time, we want to be able to sort of really debrief people, make sure we're ensuring their psychological safety, then we need those high staffing levels to meaningfully facilitate that. So it can rely on a flipped classroom approach. So what I mean by that is actually giving students quite a lot of pre and post reading materials, particularly pre, to facilitate the content in the session, which then obviously relies on engagement. One barrier can be it may not be realistic to students and can prevent that immersion. So depending on the modality of simulation, particularly talking about face-to-face simulation in real-time simulation environments, there can be, particularly with some of the high-fidelity task trainers, there can be a concept that we call uncanny valley, where actually we are using human-like representations such as mannequins, but actually they are not human, and that can create a barrier to learning with that and a barrier to that immersion in the situation. So again, with more research and development as to how we use technologies that is integral to sort of overcoming that barrier. And also it can be very time consuming as well. As I say, it's something that needs to be facilitated potentially in smaller groups. And so it's something to consider when planning that. So onto the teaching space. So at the University of Bradford, we recognised as a team it was a time for change in how we delivered midwifery education. And this was 3 years ago in the summer of 2021. So we were getting into that post-COVID environment. We had a new curriculum, and we needed to look at how we were going to continue to change the way we deliver teaching for our future midwifery cohorts. So the previous room we had was too small for the expanding numbers. We'd had successful HE bids for procuring more equipment, but actually didn't have the space in which to house and facilitate that equipment for teaching. COVID obviously was completely transformative in the way we live a lot of the ways we live, and one way was that in how we approach teaching. So thinking about immersive technologies, blended learning, and how and embedding the digital into our teaching and lives. So that was again thinking about how we can utilize that, improving student experience. As we know, students did. It was a very, very challenging time for students, all students, but particularly healthcare students. So we're looking to improve that, implement improved simulation and digital technology into learning. So one of our core aims when we started this project was how are we going to keep the pedagogy at the centre of it. So in our design, our facilitation, we want to facilitate a simulation pedagogy. We also use problem-based learning, and we wanted to be able to facilitate a dynamic space that was praxis-based learning. So bridging that gap between theory and practice to make learning as real as possible for students. So we spent 18 months building a business plan, and then we got a £1 million funding to then start work on our new space. So the vision was a multifunctional dynamic space driven by implementing a simulation and problem-based learning pedagogy. I know I've said quite a lot of this, so that's why I'm blasting through it. Enables blended learning. So we looked at things of how can students access remotely. We've got some blended learning programs and midwifery programs at Bradford. So how can we facilitate that and then enhance learning? How can we facilitate high fidelity simulation as well as low fidelity simulation? So we looked at some integrated simulation based software and how we can embed the hardware to facilitate that. Building for different learning styles. So, we're very much at Bradford, we want to facilitate everybody to learn. We don't want to subscribe to one way of learning, because we actually recognise, as I'm sure all institutions do, actually the value of different learning styles and the value that different people bring to that. So actually what we very much thought about at the core was how can we look at facilitating different learning styles within our teaching space, and then building that into our teaching curriculum and our sessions. And then looked at embedding digital and immersive technologies to enhance student learning, knowledge and experience. So this is one of the plans that we had. So this space, this did become the space. This was our initial plan. Everything on this plan, so all the chairs, all the tables, everything is on wheels. Everything is movable, because we wanted, we're doing this session, what do we want it to look like? So to make it a completely dynamic space. So none of I don't know if you can see my mouse, but all these jagged lines, they were just examples of how the space could be used. They are not actual physical dividers. Here's another example of the room set up as a lecture in a more traditional lecture. So this is what the room ended up looking like as a plan. I don't know if everyone can see my mouse, but on the left-hand aspect, so this top grey bit is more of a hospital high-risk area where we facilitate this simulator high-risk simulations. And this, we've done triage, and we've done enhanced maternal care, more of that hospital focus. And this bottom bit is, and we particularly wanted the floor to look different because, again, just thinking about that immersion, could be a home birth, could be a community clinic, but I know it sounds something simplistic as a floor, but actually we wanted that feeling. And then the colourful floor as well. Again, we wanted it to be waves, we wanted it to be colourful, we wanted it to be calming. You know, sort of tried to think of everything to kind of really make it a holistic, dynamic space. And in these spaces here, we have a breakout room as well. So we use that to facilitate some smaller group teaching, but also particularly when we're thinking about simulation, it's there as a breakout room. So it can be there for if people need to take a break. So we're thinking about sort of preserving psychological safety. It can be there as a holding room is probably not the best terminology, but say if it's an evolving simulation session, you know, if somebody pulls the emergency buzzer, it will go from that room. So again, just thinking about how when we design the space, how we could utilise those different areas, and the importance of having something separate to the main space. So the digital technologies we have in the midwifery space, so we have SimEPR, which is simulated electronic patient notes. So this has been really useful. It is a platform that is not affiliated with any EPR system used in the country. It is purely made for simulation and learning. So it is really good for teaching, and also so students get the experience of using an electronic patient record, but then we're not teaching them how to use a specific system, because students, you know, access diverse locations of trust. We've got things like HoloLens, which has AR capability. We have a big LED wall, the sim control room, as I mentioned. Learning spaces, the simulation software. Sorry, I'm going quickly, I'm conscious of the time. High fidelity mannequin, and technologies to support. I put at the bottom, the technology is there to support simulation, not to replace human interaction. So what continues to drive our learning and our teaching is our delivering holistic education, delivering midwifery education and woman-focused education. And although we've got this amazing room, we've got this amazing technology, that still remains at the core of it. The core of what we do is for the women we care for, and to keep those core midwifery values. So that's why I kind of put that there, because what we've got is amazing, but that is why we're doing it, and that is what we want our focus to continue to be as a team. So here are some pictures of what we've been using the room for. So we've had some IPE, but if you can see, I mean, the floor kind of gives it away which bit of the room it is, but so we've got at the top left-hand corner that we had a home birth scenario with sort of our team. The top right-hand corner, we had a fantastic IPE session with our physician associate colleagues, and the lady on the bed there is an actor who was in early labour. We've got the big group is a debriefing session, and then we've got how the room could be set up with clinical skills. So it's a really, these are just some examples of how we've been using the room in 3 months, but the scope of how we can use it as a dynamic teaching space will just continue. Initial feedback from students has been very positive. Students have valued having their own space. They've enjoyed being able to access the midwifery equipment. So even when we're teaching more of a traditional lecture, we can then, we have our kit available. So actually we can then bring in those practical elements into what would normally be a traditional lecture if it was a non-midwifery space. So again, to really bridge that theory practice gap and to teach in a more diverse way. And the initial evaluations of the simulation sessions have been well received. The room itself, it is going to be the start of us building our research community at University of Bradford and beyond. So we've got research looking at the use of embedding simulation midwifery, research looking at digital technologies to support simulation, facilitate holistic learning. One of my colleagues also has a very specialist interest in digital technologies, so looking at that specifically as well. We're very interested in making sure what we design, as I say, is meaningful. So we're looking at co-creation with students, with service users, again, to make the simulation and practice partners, of course, but as real as possible, and to think about the impact on practice, patient safety, interprofessional opportunities. And I've put at the bottom, it facilitates a broad spectrum of research properties. Oh gosh, projects through accessibility and technological capabilities. So even beyond the subject of simulation, we're hoping it just starts that research community and students and staff coming with ideas and really building that, and looking forward to the future. Just over time, so I do apologise, but thank you very much for listening to me and having me on. I really appreciate it.